Today we are going to discuss Gianotti crosti syndrome. The second name for this syndrome is the papular acrodermatitis of childhood or papuloacrodermatitis of infancy. So by remembering this second name, you can remember the main features of this disease. Uh, it clear-cut defines that the disease is more common in the childhood or infancy. So the age group is 6 months to 12 years. And the papular, you can remember the presentation. This is dull red colored papules, erythematous papules basically, that are flat topped, which after some time are converted into purpuric staining. These flat top papules are also found in the LP. So in differential diagnosis, you have LP or lichenoid drug eruptions, and these papules are itchy papules. So in differential diagnosis, you can also add scabies. So this was the general view, and acrodermatitis tells you the location of the papule. So acral sites, mainly extremities, and face is involved, with relative sparing of trunk. Now there is a very long list of causes of Gianotti crosti syndrome. The mnemonic is this line: "Hi, my son, Mr. Paul Ben caught mumps." By this mnemonic, you can remember all the causes that are causing Gianotti crosti syndrome. With hi word, you can remember virus HSV, Hep B, Hep C, HIV. These are causing virus that are causing Gianotti crosti syndrome. HHV6 also. And my for mycoplasma, Sun for streptococcus, Mr. for Milker's nodule, and MCs, which is molluscum contagiosum. Paul for polio. Along with that, you remember rotavirus also. With Ben, you can remember Bartonella and Borrelia. With Cort, Coxsackie, and cytomegalovirus. With cytomegalovirus, you pair up two viruses also, which is Epstein-Barr virus and parvovirus B19. And mumps as such mumps. So these are all the viruses that are causing Gianotti crosti syndrome. Now comes the prognosis or fate of the disease. So this is self-limiting disease, nothing to worry about it, and it heals in 2 to 8 weeks duration with mild discommission. So all you have to do is to give emollients to the child and reassure the parents. And if there is recurrence, then you can remember R for recurrence, R for ribavirin. So ribavirin can be given in recurrent cases. One very important point to remember about this topic is the most common cause of this condition is hepatitis B. So with hepatitis B involvement, two things to remember. The rash with the hepatitis B is not itchy. And the second thing is with lab, you have to do LFTs also. This is important MCQ also. So in the patients of Gianotti crosti syndrome, if one asks you about what lab investigation you are going to do, so these are the liver function tests, because ESR is normal in these patients. And in histology of this, histology, you can remember this is a papule, so the epidermis is heaved up, there will be hyperkeratosis. With parakeratosis and acanthosis. And sometimes papule contain fluid also, very minute fluid, so spongiosis. And there will be perivascular lymphocytic infiltrates. So this all summarizes your topic.